It's a privilege to be here with you today. Okay, yes. Nothing to disclose, of course. And, well, I guess by now we have accepted that transcatheter mitral repair is here to stay. And as you can see, already back in 2015, these are the data from Germany, the number of mitral procedures exceeded the number of surgical mitral repair. So this is striking for surgeons, but this is the reality going on around the world. And of course, the mitral regurgitation that the interventional cardiologists are treating is the same we are treating in surgery. So there are a number of patients who suffer from moderate and more than moderate tricuspid regurgitation. As you can see, this is the TRIMI registry, one of the largest mitral registry, the German mitral registry. And as you can see, more than 50% of the patients suffer from moderate or more than moderate severe TR. And of course, in mitral clip, as in every other situation, severe tricuspid regurgitation is a negative prognostic factor in relation to survival in the long run. Indeed, there are a number of transcatheter devices targeting the tricuspid that have been already developed and already used in the human. So in this scenario, what we wanted to do was to really take a look and understand a little bit more what is the prevalence of tricuspid regurgitation after mitral clip, and which are the predictors that can let us know before who are the patients who are going to stay with a significant tricuspid regurgitation. So what we did was basically took all our patients, mitral clip patients, with 1 year follow-up, excluding patients with etiologies other than FMR and DMR, excluding patients who had a mitral clip on the tricuspid, excluding patients who had RV lead implantation within 1 year after the procedure, and excluding patients who had conversion to surgery and mitral, any kind of mitral reintervention within 1 year after mitral clip. And so we end up with 269 patients, 192 FMR and 77 DMR. Nothing really special about the baseline features, a typical mitral clip population. What is interesting, of course, is that similar to the TRIMI registry, also in our experience, around 50%, even more than 50% of patients had some degree of significant TR, 2+ or more. And of course, this is something that we would treat as surgeons if we will get to operate on these patients. And the other thing I think it is interesting is that in the FMR group, as you can see, basically 2 patients out of 3 have a RV lead going through the tricuspid, and of course this is an important mechanism. It can impair tricuspid regurgitation and also can impair today at least the possible transcatheter therapies on the tricuspid. A key result, some degree of mitral regurgitation, residual mitral regurgitation was left, as always, around 30% if we consider also 2+ MR, that we consider a suboptimal result after mitral clip. And we can see already that quite a number of patients immediately show a reduction of tricuspid regurgitation degree, although some, around 10%, maybe 1 out of 10, also show at a progression, a worsening of tricuspid regurgitation at discharge. 1 year mortality was around 20% for FMR and 8% for DMR. And as you can see in FMR, a trend toward increased mortality per increasing preoperative tricuspid regurgitation degrees was observed. So this is the paired tricuspid regurgitation evolution in FMR. And as you can see, we did observe a significant reduction at discharge, so immediately after the procedure. But we also observed a significant comeback of tricuspid regurgitation at 1 year, going basically up to 19% in this case. And indeed, we lost the statistical significance when we compared 1 year to baseline. The same was true for DMR, basically. Again, good reduction immediately postoperatively. Again, come back at 1 year. And again, no statistical significance between baseline and 1 year. I mean, there was some reduction, again, around 20% of surviving patients, but not significant. Of note, it's also worth to remember that at 1 year, the tricuspid regurgitation distribution between FMR and DMR were not different. So when we looked at the predictors of 1-year tricuspid regurgitation in these patients, we found that in FMR, right ventricle dysfunction, baseline preoperative right ventricle dysfunction as assessed by SCDI, and the postoperative, the persisting elevated systolic pulmonary artery pressures were the only two independent predictors of increased rate of tricuspid regurgitation 3 and 4+ at 1 year. In DMR, on the other hand, preoperative tricuspid regurgitation 3+ or more, residual MR 2+ or more, and again, systolic pulmonary artery pressure still elevated after the procedure predicted increased rate of DR at 1 year. In both groups, as was expected, worse degrees of tricuspid regurgitation were observed in patients who had mitral regurgitation recurrence. As you can see, basically, both in FMR and DMR, if you get mitral regurgitation 3+ or more, you will have 50% of the patient having 3+ or more of tricuspid regurgitation. And in turn, of course, also worse NIA class, worse symptoms were observed in patients who had worse degrees of tricuspid regurgitation at 1 year. So, of course, this is a very small study, single center, retrospective, short follow-up. And of course, there is an important bias due to the fact that patients who have severe MR tend to die more than patients who don't have. So you naturally miss this patient at follow-up because they simply die before. And then the last limitation, of course, is the lack of precise echocardiographic data about the tricuspid, annulus, leaflet tethering, and also about the right ventricle and right atrium volumes and function. So in conclusion, in our experience, we can say that a weak improvement of tricuspid regurgitation at 1 year after isolated mitral clip was observed. Tricuspid regurgitation initially decreased, but tend to recur at 1 year, around 20% of surviving patients. Persisting elevated systolic pulmonary artery pressure at discharge and recurrent 1-year mitral regurgitation were associated with increased tricuspid regurgitation. Worse 1-year symptoms were observed in patients with worse tricuspid regurgitation. And we believe that maybe, I'm not sure if today, but in the future, selected patients submitted to transcatheter mitral repair may be considered for transcatheter tricuspid intervention. There is room for these technologies. Thank you very much.